Diabetes tests and diagnosis. Diabetes tests and diagnostics are for people at high risk, as diabetes often has no symptoms. Understand your results and work to reverse your diabetes. Your healthcare professional can diagnose diabetes, prediabetes, and gestational diabetes through blood tests. A blood test shows your blood sugar. Do not try to diagnose yourself if you think you might have diabetes. Testing equipment that you can buy over the counter, such as a blood glucose meter, cannot diagnose diabetes. Diabetes tests for people at high risk. Anyone who has symptoms of diabetes should be tested for the disease. Meanwhile, some people will not have any symptoms but may have risk factors for diabetes and need to be tested. Testing allows healthcare professionals to find diabetes sooner. At the same time, work with their patients to manage diabetes and prevent complications. Moreover, testing also allows healthcare professionals to find prediabetes. Making lifestyle changes to lose a modest amount of weight if you are overweight may help you delay or prevent type 2 diabetes. Type 1 diabetes tests. Most often, testing for type 1 diabetes occurs in people with diabetes symptoms. Doctors usually diagnose type 1 diabetes in children and young adults. Because type 1 diabetes can run in families, even if they don't have symptoms. Type 2 diabetes tests. Experts recommend routine testing for type 2 diabetes if you are age 45 or older, are a woman who had gestational diabetes, or are between the ages of 19 and 44, are overweight or obese, and have one or more other diabetes risk factors. If you have insurance, ask your insurance company if it covers diabetes tests. Though type 2 diabetes most often develops in adults, children also can develop type 2 diabetes. Experts recommend testing children between the ages of 10 and 18 who are overweight or obese, and have at least 2 other risk factors for developing diabetes, such as low birth weight, a mother who had diabetes while pregnant with them, any risk factor mentioned in risk factors for type 2 diabetes. Gestational diabetes tests. All pregnant women who do not have a prior diabetes diagnosis should be tested for gestational diabetes. Therefore, if you are pregnant, you will take a glucose challenge test between 24 and 28 weeks of pregnancy. Tests to diagnose prediabetes and diabetes. Healthcare professionals most often use the fasting plasma glucose (FPG) test or the A1c test to diagnose diabetes. In some cases, they may use a random plasma glucose (RPG) test. Fasting plasma glucose (FPG) test. The FPG blood test measures your blood glucose level at a single point in time. For the most reliable results, it is best to have this test in the morning, after you fast for at least 8 hours. Fasting means having nothing to eat or drink except sips of water. A1c test. The A1c test is a blood test that provides your average levels of blood glucose over the past 3 months. Other names for the A1c test are Hemoglobin A1c, HbA1c, glycated hemoglobin, and glycosylated hemoglobin test. You can eat and drink before this test. When it comes to using the A1c to diagnose diabetes, your doctor will consider factors such as your age, and whether you have anemia or not, or another problem with your blood. The A1c test is not accurate in people with anemia. If you're of African, Mediterranean, or Southeast Asian descent, your A1c test results may be falsely high or low. So, your healthcare professional may need to order a different type of A1c test. Your healthcare professional will report your A1c test result as a percentage, such as an A1c of 7%. The higher the percentage, the higher your average blood glucose levels. People with diabetes also use information from the A1c test to help manage their diabetes. Random plasma glucose, RPG, test. Sometimes healthcare professionals use the RPG test to diagnose diabetes when diabetes symptoms are present and they do not want to wait until you have fasted. You do not need to fast overnight for the RPG test. And you may have this blood test at any time. Tests to diagnose gestational diabetes. Pregnant women may have the glucose challenge test, the oral glucose tolerance test, or both. These tests show how well your body handles glucose. Glucose challenge test. If you are pregnant and a healthcare professional is checking you for gestational diabetes, you may first receive the glucose challenge test. Another name for this test is the glucose screening test. In this test, a healthcare professional will draw your blood 1 hour after you drink a sweet liquid containing glucose. In particular, you do not need to fast for this test. When your blood glucose is too high, 135 to 140 or more, you may need to return for an oral glucose tolerance test while fasting. Oral glucose tolerance test, OGTT. The OGTT measures blood glucose after you fast for at least 8 hours. First, a healthcare professional will draw your blood. Then you will drink the liquid containing glucose. For diagnosing gestational diabetes, you will need your blood drawn every hour for 2 to 3 hours. High blood glucose levels at any 2 or more blood test times during the OGTT, fasting. 1 hour, 2 hours, or 3 hours till you have gestational diabetes. Your healthcare team will explain what your OGTT results mean. Healthcare professionals also can use the OGTT to diagnose type 2 diabetes and prediabetes in people who are not pregnant. The OGTT helps healthcare professionals detect type 2 diabetes and prediabetes better than the FPG test. However, the OGTT is a more expensive test and is not as easy to give. So, to diagnose type 2 diabetes and prediabetes, a healthcare professional will need to draw your blood 1 hour after you drink the liquid containing glucose and again after 2 hours. The resulting numbers. Each test to detect diabetes and prediabetes uses a different measurement. Usually, the same test method needs to be repeated on a second day to diagnose diabetes. Furthermore, your doctor may also use both tests to confirm that you have diabetes. The following table helps you understand what your test numbers mean if you are not pregnant. Other diabetes tests can be helpful. Even though the tests described here can confirm that you have diabetes, they can't identify what type you have. Sometimes healthcare professionals are unsure if diabetes is type 1 or type 2. A rare type of diabetes that can occur in babies, called monogenic diabetes. It can also be mistaken for type 1 diabetes. Treatment depends on the type of diabetes, so knowing which type you have is important. To find out if your diabetes is type 1, your healthcare professional may look for certain autoantibodies. Autoantibodies are antibodies that mistakenly attack your healthy tissues and cells. The presence of one or more diabetes-specific autoantibodies is common in type 1 diabetes, but it is uncommon in type 2 or monolithic diabetes. A healthcare professional will have to draw your blood for this test. If you had diabetes while you were pregnant, you should get tested no later than 12 weeks after your baby is born to see if you have type 2 diabetes. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.